My name is Dr. Gaurang Krishna. I'm a hair transplant surgeon at Medlinks. A surgery of let's say 33,500 grafts, which is done through the FUE technique. About 4 hours of extraction and about 4 hours of implantation. 1 hour of slit making. That's 9 hours of working time stacked plus the breaks that the patient takes, breaks that the doctor takes. A typical surgery lasts for 10 to 11 hours, which is a huge time. And that is the reason why many hair transplant clinics do not even attempt doing a 3000 or 3500 graft procedure in a single day. The surgery goes for 2 days. Whereas at Medlinks, we routinely finish 3500 graft surgeries in 5 to 5.5 hours. So it eliminates multiple problems. It eliminates the problem of coming back to the clinic on the second day, taking the anesthesia pain again, taking off from work again. And of course, it's a hassle. It also eliminates the risk of a overlong surgery on a single day. Why do we do not want to do a 10-hour surgery in a single day? Because human fatigue factor always comes in. It comes from the patient side, it can come from the surgeon side. So once you start getting tired, once your eyes or once your hands start getting tired, the quality of course deteriorates. So we do not want our surgeries to last more than 6 hours. Third reason is the anesthesia that we use, the longest lasting anesthesia that we use, bupivacaine or ropivacaine, the effect lasts for 5 to 6 hours. And if I want my surgeries to go on for 10 hours, I have to repeat the entire anesthesia again after 6 hours, which causes complications, which causes anesthesia overdose, which can cause vasovagal syncope, which can cause a lot of swelling on the patient's head. So multiple things are avoided by doing extraction and implantation at the same time. Theory is different. Theory says that definitely if you're not storing the graft, the results will be better. But that's theory. What we actually see, what benefit you get, what benefit the patients get when we are doing the perfect eye technique is number one, a big surgery can be completed in much lesser time in a single day, and even when we compare one single day in much lesser hours. So much better patient comfort levels, much better surgeon and surgical teams comfort level. Number two, faster results. A result that you normally expect around 8 to 9 months, many of our patients are getting it in 3 to 4 months. Number three, much better results. Many hair transplant clinics consider 80% growth as a super successful result. But here at Medlinks with the perfect eye technique, anything which is below 90% is a failure. And we rectify it if that happens. Very, very unlikely. But sometimes we do see it. You can call it human error or it can be a matter of chance. But once in a year, we do have patients where the growth we felt was less than 90% and we do, for us, it's a failure. No, we do corrective transplants in such cases. So there are multiple advantages of this perfect eye technique, this real-time and instant follicular extraction and implantation, and that is why at Medlinks, the most commonly performed hair transplant is through the perfect eye technique. So folks, this was all about what we do in hair transplants at Medlinks, how we approach the perfect eye technique, why we shifted from FUE to perfect eye, and what are the advantages that our patients get through this technique. If you have any follow-up questions and if you have any further doubts about the perfect eye technique, or if you have any contradictions to what I have said, please ask us in the comment section and we'll try to answer all your questions and we'll also try to satisfy your contradictions. Thank you so much. This is Dr. Gaurang Krishna signing off.